Alright, so for the next aspect as related to labor, we're just trying to revisit the anatomies of the pelvis and perineum, right? So here we'll be talking about the anatomy of the pelvic brim or the pelvic inlet, so that, it will kind of like, refresh our knowledge, okay, of what we learned from anatomy and what we're actually trying to apply in the obstetrics and gynecology. So this is a pelvic inlet, okay. The inlet is like the space, while the brim is like the landmark of the space, right? So they usually discuss them together, okay. So pelvic brim, also known as pelvic inlet, some people even call it, they interchange it like that, okay. But just so you know, the inlet is the space, while the brim is the landmark that makes up the space, so you can interchange the words. So it's a critical anatomical landmark. It marks the boundary between the greater, that's a false pelvis, and the lesser, that's a true pelvis. So the shape of it is oval, is like heart shaped, okay. Orientation is obliquely angled, tilted forward in what anatomical position. Function is the entrance to the true pelvis. Okay, so it's important in obstetrics because they access the dimensions, okay, that's the length and everything of this place. So when they access it, they can now be able to like have an idea if a woman can be able to undergo delivery through the vagina or not, okay. So proceed. So the pelvic brim is formed by a continuous bony ridge made up of anterior, okay, the lateral and the posterior, okay. So on the anterior you have the pubic symphysis, the pubic crest. On the lateral you have the pectineal line of the pubis and the arcuate line of the ilium. On the posterior, that's like at the back, you have the sacral promontory, okay. At the back you have the sacrum, right? So sacral promontory and the alar wing of the sacrum. So clinical relevance is the size and shape is very important to determine if a woman can deliver a baby through the vagina or not, okay. So in females it's wider, is rounder. Now this is because females will undergo child birth, you understand. So in males it's narrow, it's just a heart shaped, is small, right? Because it's not, how will I say, it's not evolved for childbirth.